Hi, this is Dr. Slave Gallagher. I am a plastic and reconstructive surgeon specializing in gender affirmation surgery. So this morning I want to answer what's a super important question for many of our patients, and that is, will my surgery be covered? And really to help you give a little, or help give you a little bit of insight into how insurance works for treating gender dysphoria. So how patients usually ask us is, I have Anthem, I have United, does this mean I'm covered? So this is really not the important part of the puzzle. There are many different insurance companies, and within those insurance companies, they have different plans and policies. And what really matters is what your employer has chosen to provide you as an employee, whether or not you have benefits to cover gender dysphoria. So this can be quite tricky to figure out because it's not always entirely obvious when you read your policy, and oftentimes a phone conversation is required with a representative that unfortunately may not be very well educated in this. So the good news is a lot more patients than ever before have access to benefits for gender dysphoria when we look at private insurers. And one very useful document from the Human Rights Campaign is the Corporate Equality Index. You can Google that. And in their 2018 report, it looks like about 70% of Fortune 500 companies are now providing their employees with benefits. And so this means a lot of big companies, McDonald's, Starbucks, Amazon, Google. So the great news is now more so than ever, folks have access to care for their gender dysphoria, which oftentimes includes surgery. There's a lot of variation as to what surgery is provided, and oftentimes, unfortunately, still facial feminization and feminizing mastoplasty, those procedures oftentimes still won't be covered. The other thing to know is there is a lot of variation in the different policies as to what requirements are needed prior to surgery. And so whereas us as providers, we're trying to stay away more and more from gatekeeping as much as possible, sometimes we see in those policies that there's a little extra requirement. For example, one we see a lot is that 2 letters from PhD or MD level providers are required before, for example, undergoing bottom surgery. So, if we tell you that we have this extra requirement, please bear with us. We try to educate the insurance companies as much as possible to have requirements that really align with the best known evidence or the WPATH requirements, but this unfortunately is not always the case, and sometimes your insurance policy itself can be the gatekeeper. For Medicaid patients, unfortunately, right now in the United States, we're still very much behind in this. So in the state I practice in, Indiana, if you have Medicaid in Indiana, unfortunately you're not covered right now for gender dysphoria. However, there are many states and that's for surgery in general. If you're a Medicaid patient, you can try to appeal a denial, but this ends up being a long process, and we have several of those appeals we're involved with right now. There are several states, however, that have protections in place so that if you are a Medicaid patient, it's considered discrimination if you aren't provided with treatment for your gender dysphoria. And these great states include Massachusetts, of course, California, and various other states. But unfortunately, right now, the majority still don't have these protections in place. So it can be very confusing, it can be challenging, but we've had many success stories, and what we try to provide in Indiana is a service for our patients by which we don't want you to have any nasty surprises. We don't want to ever bill you for something you thought was going to be covered by your insurance. So what we do is on our website, www.universitygenderaffirmationsurgery.com, we have a little portal there where you can submit your information, and Nicole, our coordinator, will liaise with your insurance company opportunity just to see exactly where you stand before you ever see us. So it does take us a little bit of time. It's oftentimes a phone conversation for each patient, and I've heard Nicole staying on hold with insurance companies for 40, 50 minutes, an hour. So please bear with us. It takes a little bit of time to respond, but we will always get back to you. And so that website, it's in our bio, but again, it's www.universitygenderaffirmationsurgery.com. I hope this was helpful.